Yeah, good morning, my viewers of this channel. I remain your friend, your Dr. Wallace Olumese, and I'm here again to continue our discussion on death. You do not have to die. Yeah, in our last discussion, we talked about the effect of high blood pressure on your various system and how high blood pressure progresses to cause damage to various organs in the body. Here we talked about the how the pressure leads to resistance to the flow of blood and makes the blood move sluggishly and all the other attendant effects of this development. So I like to advise you, if you didn't follow up on the last video, you can go back to the channel, search for the last video. That was the second episode of Death That You Do Not Have to Die. And view the video and listen to the information so that you can follow through with this third episode. So in addition to the effects of blood pressure of the elevated blood pressure on the various organ system, it is important for us to note that when the pressure in the blood vessel is raised, because the heart has to pump blood into the vessel, the pressure that is elevated in the vessel becomes a kind of resisting force or a force of resistance to the movement of blood from the heart to the vessel. Now, in a bid for the heart to overcome this pressure or overcome this resistance, it begins to work harder than it ought to do ordinarily. And in the course of the heart working harder, it results in various changes in the heart. It's just like when you go to your gym or you do push-up exercises, your muscles work harder, and after a while, you see that the muscles begin to increase in size. That is exactly what happens to the heart. And as the heart begins to increase in size, it also begins to affect how the heart functions. And this can also lead to damage of the heart and all the other attendant effects of any damage that can occur in the heart. So with the foregoing, I believe it is now clearer to us that high blood pressure is a potential destroyer and can destroy a lot of organs and systems in the body. So it is very important for us to catch it on time and then deal with it decisively so that it doesn't go ahead to damage the organs in our body. Now, like I said to you in the last video, I'd like you to keep it in mind that high blood pressure is not a death sentence. Rather, if it is caught early, it can be handled properly. Now, someone may begin to wonder, how do we get high blood pressure? How does it happen that blood pressure begins to increase? Yes, we know that for someone to get malaria, he has to be bitten by a mosquito carrying the parasite. But in high blood pressure, the way it begins or the way it originates, it's not very, very clear. Now, there are two forms of high blood pressure. Right now, we're talking about how high blood pressure originates. There are two forms of high blood pressure. One when go primary school, and the other one when go secondary school. So they are called primary hypertension and secondary hypertension. Now, for primary hypertension, with all the research that science have done thus far, they have not been able to clench their hands on anything that causes high blood pressure, that makes the blood pressure to be elevated. And that is why science also refer to it as essential hypertension. Now, for secondary hypertension, science have been able to outline some factors or some things that may actually have resulted in it. For example, some drugs can lead to high blood pressure, like oral contraceptives, antidepressants, and the drugs that we take, some of the drugs we take for pain relief. These drugs can lead to high blood pressure when they are taken for a long time. Then also problems with the adrenal glands, problems with arteries and heart, problems with the thyroid. All of these can lead to secondary hypertension. Now, secondary hypertension just causes about 5 to 10% of the high blood pressure that we see in individuals. The bulk of the high blood pressure is usually from primary hypertension, where no particular factor have been noted to cause it. However, issues with the way we live our lives have been implicated to be responsible for it. Now, if you have 10 people who have high blood pressure, there's a likelihood that 9 out of these 10 people are going to have primary hypertension or essential hypertension. Now, for secondary hypertension, usually results in patients that are younger in age. But for the secondary hypertension, it can be found in those who are older. Now, there's a mix or a combination of genetic factors and environmental factors. For example, if your father or your mother had high blood pressure, or a relative of yours have high blood pressure, you need to be on the lookout, because there's a likelihood for such an individual to develop high blood pressure in the course of their lives. Now, issues like people who drink lots of alcohol, take lots of salt in their diets, who eat unhealthy meals, who engage in very low physical activities, what is called a sedentary lifestyle, as well as people who are overweight and go through a lot of stress. This, together with people who smoke tobacco and all other smokables, these, in addition to genetic factors, age, can lead.
Still shooting. Shooting what? So I'm going to subsequently I'm going to be doing some videos that's going to touch on those areas, those factors that can predispose one, those environmental factors, factors that have to do with the way we live our lives, the things we eat, the level of activity that we perform as individuals, and how they affect our blood pressure. Now, those of these, some of these things I've already mentioned as we previously, some of those environmental factors that can be responsible or that can predispose one to high blood pressure. Now, one by one, I'm going to pick them and I'm going to be highlighting them in videos that I'm going to make subsequently. For example, in the videos that are going to be coming subsequently, I'm going to be telling you how you can moderate your alcohol intake, how to go about the cessation of tobacco smoking or any kind of smoking that you're involved in, then how to reduce your weight, also what constitutes a healthy diet, how to reduce your salt intake, your fatty intake, because all of these things affect your blood pressure, just like we said earlier. Now, what are the symptoms of high blood pressure? What are those things that someone will experience in his body and then will make such a one begin to think, could this possibly be high blood pressure? Now, like we said earlier in previous videos, that hypertension is a silent killer because it has no specific symptoms. However, if someone begins to experience recurrent headaches, changes in your vision, chest pain, shortness of breath, generalized weakness, things like dizziness, some of these things can be, or some of these symptoms can be pointers to a raised blood pressure in an individual. However, these are not exclusive symptoms, or these are not a definitive symptoms of high blood pressure in any individual. However, if as an individual you're experiencing these symptoms, it will make sense for you to check your blood pressure, especially for those who have genetic predisposition, like those who have parents, loved ones, relatives who have been diagnosed hypertensive. Now, how do we take care of high blood pressure? How do we manage? How do we prevent? Now, the first thing is to engage in regular blood pressure checks. Now, this can be done by obtaining an automated blood pressure monitor. You can get that to buy in any shop where medical equipment are sold. Or if you need one, you can request one. You can send me a message and then I'll find a way to get one for you. Now, these automated blood pressure machines are very handy. You can use them to check your blood pressure in the home, in your home, in the comfort of your home, and then register or take note of what the values are over time. And this can be helpful for people who are or people who usually have white coat hypertension. White coat hypertension is another variant of high blood pressure, and that is found in people who get extremely agitated when they are in a hospital environment. And as the name implies, when they see the white overall and white uniforms of nurses and doctors, they are agitated and their blood pressure tend to rise. So for these people, measurement of blood pressure within the hospital environment may not be helpful for them. And these people will do well when they measure their blood pressure in the comfort of their home using an automated blood pressure machine. Now, in the previous videos, I told you what the normal values are and the abnormal values are. So if you haven't seen those videos, please go back to the page and look out for those videos and follow up accordingly. Now, when you have checked your blood pressure and the blood pressure probably have gone beyond the normal limits, then the first thing to do is, yes, you need to see a doctor, fine, but depending on the duration of time over which you have experienced this elevation in blood pressure, the doctor may recommend lifestyle changes for you, for those who have history of going through stressful situations. Now, a program may be organized for you by the doctor to get you off the stressor, or to make you see how to find ways of converting that stressful situation into a restful situation. In time coming or in the days ahead, I'm going to do a video for us to see how we can convert stressors into things that we can use or situation we can use to relax ourselves. Then apart from getting you off stressors, now they may need to look at your diet, your dietary history, and see what the constituent of your diet is. Basically, to maintain optimal health and to have a good blood pressure, is expected that individuals should stay away from certain kind of foods. For example, foods that are high in calories, high in carbohydrates and sugars, those foods have to be reduced in your meals. It is advocated that individuals should do more fruits and vegetables in their meals and eat more of plant-based proteins in their foods. Now, as we make progress, I'm also going to do a video on this, and you're going to see, I'm going to spell it out explicitly for you how you can have a very healthy diet. And for those who smoke tobacco, that is a no-no. You have to cease from smoking tobacco if you have to get your blood pressure to normal levels. Those who binge on alcohol or take alcohol in very high quantities, you need to cut down on alcohol or completely cease taking alcohol. Now there is this back and forth concerning alcohol. Some persons want to talk about alcohol using biblical examples, take a little wine for thy stomach's sake, and then someone to say, oh, even doctor says you should take alcohol. Alcohol is cardioprotective. Well, as we make progress, I'm going to do a video on proper use of alcohol, and then I hope that also will help you as you look at it. Then rest is very important. Yes, as one ages, one needs to take more of rest. This also could help to bring down your blood pressure and keep them at normal values. Then water intake is very key. Yes, it has been advocated that you don't have to drink water only when you are thirsty. In fact, water should be part of not only your diet, part of your daily routine. Yes, you have to keep yourself as well hydrated as possible, as this will help to bring your blood pressure to normal levels. Then also weight. Wow, that's another very tough area. Yes, high blood pressure and overweight or obesity are twins. They go hand in hand. So if you want to get your blood pressure to normal levels, you have to cut down on your weight. Yes, we're going to talk about this more in subsequent videos. Then drugs, yes. We have people who regularly go to the chemist, they are back from work, or to drug vendors, they patronize pharmacies now and then, they take all manner of drugs for pain relief and all of that. Many of those drugs you are taking can actually impact on your blood pressure, many of them. And that is why it is advocated that as an individual, you have to liaise with your medical health, with a medical health expert, with a doctor, the doctor who knows your history, the doctor who can handle you in a holistic manner, know those drugs that are safe for you and those that are unsafe for you. Drugs are a major factor, or they are a major culprit in raised or hypertension or raised blood pressure. So these are some of the things that we can do. Physical activity is also very key. When you are at home, when you are at work, instead of using the lift, use the stairs instead. Instead of getting someone to get the remote for you to put on the television, get up and pick the remote yourself. When you are at home, go around and show. Now there's a basic number of steps that every individual must take every day. But today, we have cars, so every morning we set out in our cars, and basically we see ourselves using the cars virtually all of the throughout the day. And then if one wants to count the number of steps that one takes daily, you find that it is way low beyond the recommended number of steps that you should take every day. As we make progress, I promise to bring you a video concerning levels of physical activities that account for optimal health. Now, these are some of the things that we can do that will help us to keep our blood pressure at normal values. Now, some persons will do all of these things and the blood pressure will still not come down. These ones will now require a combination of all of these interventions as well as medication use. Now, I like us to understand, many of us are scared of taking high blood pressure medication. I see a lot of patients, and when they come to me and then they are diagnosed with high blood pressure, I want to start them in with medications. They are worried. Some just take the medications for a short period of time and feel that it is all over. I believe that before this video ends, I'm going to be exposing some myths, some things that we think that are true about high blood pressure. They are actually not true. And I hope that as you get this information, you will apply and use it accordingly. Now, drug intake or drug use for high blood pressure. Many of these high blood pressure medications or antihypertensives, as they are called, are very safe. Yes, it is true that all drugs have side effect one way or the other. And that is how it is even with the things we eat, the food we take in. There are some foods that you take in, depend on how you use them. They can cause you stomach discomfort and all manner of health challenges. Now, I always like to counsel my patients to see drugs as part of their food. Yes, why would one not want to take medication, and then when medications are prescribed for you, ask, well, am I going to be taking this every day, every day? Of course, if you eat food every day, then you should be also ready to take drugs every day. Food actually are things that help us to keep our lives going. They nourish our body, they give us the necessary energy to attend to our day-to-day activities. And so medications are. As foods are there to sustain life, so antihypertensive medications are there to sustain life. We have patients who have been on this medication and have religiously followed it, and they are living their lives very well, and they are doing extremely well. So I like to say to us that regular intake of medication or prescription medication for high blood pressure is not a death sentence, neither is it an imprisonment. It is just a way, it's just a method, it's just an avenue to help you sustain your life and keep you going and save you from the devastating effect of high blood pressure, which we have mentioned in the previous videos. Now, there are a lot of antihypertensive, high blood medication. There are lots of them. There are varieties of them. Now, working together with your doctor, he work together with you in agreement, and then you can choose the drugs that have the minimal side effect and that will be good for you. Now, there are some things that some people do. The moment they have high blood pressure, they notice, oh, my blood pressure is high. they realize maybe their husband, their relative or friends are taking drugs for high blood pressure. Oh, I notice my blood pressure is high, my friend. Please, can you give me from that your medication? Let me take. And then they take it. This is not correct. Antihypertensive medications are not medications that should be taken in a short term. They are medications that are taken for long term. They are long term medications, medications that will be taken for life. And some people will come back and say to you, oh, but the high blood pressure was healed, was cured. Now I like us to understand that in as much as I do not negate I do not, I'm not against the possibility of miracles in terms of health conditions. Yes, Jesus, God can heal sicknesses, and that includes high blood pressure. But one has to be sure, working together with your doctor, that you have been completely healed of high blood pressure before those drugs are taken off. Otherwise, a spike a day in the blood pressure is enough to do some damage in your organ system. So drugs are good, and I counsel my patients, because I've seen a good number of them who have been religious with their drugs, and in years following them up, they have never had a spike in their blood pressure. Neither have the so-called side effect of those drugs affected them adversely. Many of them do not even experience those side effects. So lifestyle modification in combination with drug intake will help to keep your blood pressure down. Now, there are other variants of high blood pressure: resistant hypertension, malic. We cannot talk about that now. But at the level that we're talking, at this level, this will help us. Now, some other myths about high blood pressure that I like to deal with at this point. Now, I had a patient who had been diagnosed of high blood pressure, and I've been following up. I placed on medication. The patient was doing very well. Now, one day the patient called me, oh, I traveled to the village, and there's this place where someone is doing a herbal concussion for high blood pressure, and people are taking it and they are doing very well. I like to take it. And I said to that patient of mine, no, you don't need to do this. Your antihypertensive that you're taking the lowest dose of that antihypertensive, and it's doing well for it. Do you want to do this? Says, no, I want to try it. Of course, every patient has a right to his own decisions. All we do as doctors is just counsel and advise. The autonomy of patients is what we don't toy with as doctors. And then I said to him, well, if that is what you want to do, fine, you can go ahead. And then he went ahead. Now, weeks passed, and he called me and said, oh, my blood pressure is doing very well. This thing is working. And then after like 2 weeks, he called and said, oh, my blood pressure is going up. This. And after a while, he called again and said, oh, this blood pressure. And I said, you see, so please take that thing, stop that thing you're doing. Because many of these herbal medications, we do not know what they are made of. We do not know the dosage of whatever they are made of. We do not know their constituents. So even those who go after herbal medications for treatment of high blood pressure, they stand a risk of kidney damage, because many of these, even damage of their liver, because many of these constituents that makes these concussions are metabolized in the liver, excreted in the kidney. If they become so concentrated and so voluminous that the liver and kidney cannot handle, it can cause problems for the patient. So please, herbal medication, not the way to go. Now, there is no treatment, no cure for high blood pressure, except, like I mentioned earlier. But there is a caveat. You have to be sure of what you are doing. So this is what I have for you today on high blood pressure. And with this, I round up the first part of death that you do not have to die. Now, in the coming days or weeks, the part 2 of death that you do not have to die is going to come up. And then we'll be talking about diabetes mellitus, or what people know as high blood or raised elevated blood sugar. Now, as we do this, we are going to be talking about other things, and as we make progress, some of the issues that I have brought to the fore, In this video, we are going to expatiate more on them and do more work on them, bringing more information to you. It's like you're building a house, you start brick by brick. So follow me on this YouTube channel and you get more information. And I bet you as you do this, you have optimal, maximal health for you and your family. Thank you for listening. I remain Dr. Wallace Olumese. Stay blessed until I see you again. Bye.